Hi, this is Hannah, and I'm gonna talk about the treatment, prognosis, and nursing care plan for the patients with DIC. Uh, so, if it comes to the treatment, the most important factor in management of disseminated intravascular coagulation is to aggressively treat the underlying cause of it until it's controlled, and then correcting secondary effects of tissue ischemia. Management is individualized to specific patient, underlying cause of DIC, and the response to the treatment. Correcting the secondary effects of tissue ischemia would include improving the oxygenation, fluid replacement, correcting the electrolyte imbalances, or administering vasopressors. The treatment for DIC can go as far as the blood transfusion in case of the extended hemorrhage. However, it's not the first choice, and it's certainly not based only on the lab results. Um, uh, Other options would be use of cryoprecipitates to replace fibrinogen and factors 5 and 7. Those are factors that help with blood clotting. Also, frozen plasma can be given. This one, though, increases the risk for capillary leak and may compromise pulmonary function. Platelets may be given to correct the severe low platelets count. In case of when patient shows a predominant thrombotic factors, low molecular weight heparin can be given. And also, like in the case of profuse bleeding, fibrinolytic inhibitors with the combination with continuous infusion of the heparin is also one of the treatments, or the recombinant forms of thrombomodulin, which inactivates thrombin's coagulant activity, can be used in case of profound bleeding with DIC. Treatment basically places doctors with a dilemma: treat bleeding and exacerbate clotting, or treat clotting and exacerbate bleeding. So the answer to it may be the recent research done by the University of North Carolina, by the Department of Biomedical Engineering. They came up with the innovative approach to treat DIC using porous structured nanogel spheres that are filled with tissue type plasminogen activator TPA. This drug will breaks down the clots. So the spheres are traveling with the bloodstream, and the TPA binds to fibrin in the mini clots and then breaking them down. This causes the platelets to be released from the clot and re-recruited by the body in those sites where the bleeding is really present at the moment. So far, unfortunately, only testing on rats models and in vitro were done. But the results are very hopeful. Based on the analysis, 91 to 93% of mini clots were eliminated in heart and lungs, and 77% in the liver and kidneys. The similar results were achieved in trials in vitro using blood plasma from the patients with DIC. There are still safety considerations, especially questions like how long it will take for those nanogels to clear the body, or how they are distributed by the body. So those need to be addressed, and before even they can go into clinical trials. Let's talk about the prognosis now.